Good morning, students. Today, I just welcome all the diploma students of India. The Pharmacy Council of India have given a tentative program for the date of examination, for the exit examination. After your completion of your diploma course, you have to undergo a exit examination to become a registered pharmacist. So this is not new. Internationally, every country and even every continent also, they are having this exit examination for every diploma or degree to certify them how they have got training from the particular institution or the university is giving a value for your degree. So this is a very interesting examination, and also it will revise on the whole if it is 2-year program or 4-year program or 6-year program. It needs, when a completion of the course, the student have to be evaluated before they go for the service, especially in the health service. You should know how important for us to be more clarity, with clarified, more purified or clarified or analyzed when you say something, when you do something. It should be life-saving. It should be and meaningful. So that's why this exit examination. I have taken diploma in pharmacy. They have given 5th October 2024 and 6th October 2024 throughout India, the tentative program for diploma in pharmacy students. You have subjects of biochemistry, pharmaceutics, hospital and clinical pharmacy, pharmacology, pharmaceutical jurisprudence, pharmacognosy, pharmaceutical chemistry, drugstore and business management. So this is an MCQ type of question. So we have to undergo all subjects separately, and collectively they will ask you questions from every subject of certain percentage. Uniform distribution will be there. So we will discuss individually in one class a minimum of 100 questions in multiple choice. I can discuss with you, and you can have a training so that it will be helpful for your appearing for the examination point of view. So today we will this is the order which is given by Pharmacy Council of India, the tentative program for the exit examination for diploma students. Even it will come for degree, and this may be helpful for even one who is appearing any government examinations for entering into a pharmacy profession. So today we will discuss about pharmacognosy MCQs of 100. I may take sometimes for one question 1 minute or maximum and a half or 45 seconds, but you should have a capacity to finish a question within 30 seconds. So you should have a practice. After listening, you should also go for model question papers to be solved by individually. So first question in pharmacognosy for diploma students, what are the sources of crude drugs? Crude drugs, they are asking what are the sources. They are given choice like plants and animals, mineral and marine, plant tissue culture and microorganism. And this makes the students to be very clear. The crude drugs which you have studied, it's all the above. It can be obtained from a plant, animal, mineral, marine and tissue culture and a microorganism. Next question, which one of the following is a animal originated crude drug? Animal originated. They have given choice, wolf fat, acacia. You know acacia is Acacia senningal plant. It is an unorganized drug exudate which is taken from a plant. Senna, we know it is a leaf which is used for laxative purpose, androgen glycoside which you might have studied. Ephedra which contain alkaloids, ephedrine, and there are ergometrines are also present. And so that we can see that the answer is wolf fat. You know very well, wolf fat, wolf fat. The picture which shows the wolf fat is taken from animal source. The answer is wolf fat. The example of a drug belonging to marine source they have given marine source of drug. Select carrageenan, wolf fat, Nixoamica and citin. So we can say carrageenan is the answer for marine. Another one doubt is there. Citin, what is citin? Citin is obtained from even crab, starfish, but it is also present in insects like cockroach, spider, many other insects also it is available. So that purely when you want to say, even when it is crab and prawn and this citin may be present, why can't we cannot select citin? It may be a doubt for the student. Be clear. There is freshwater crabs are there, freshwater prawns are there. So there are insects also contain citin. So that's why we are taking purely carrageenan is from red algae. It's a marine product. So carrageenan is the answer, all the four choices which they have given. Wolf fat we know it is from animal, and Nixoamica we know it is a seed which is from the fruits of that is Strychnus Nixoamica plant, and citin is only the choice which we want to talk about. That also I have explained you. Now the shellac, shellac is an example of source of drug of natural origin which is obtained from. They have asked shellac, from which natural origin, which source which is up. So shellac, we think that we know that shellac usually for plumbers, painters, they may be using for various purposes. It is obtained from plant, but it is not exactly from the plant. It is produced by a bug, an insect in the plant. So shellac is a resin, is a product of resin, unorganized drug, exudate, which is produced, secreted by the female lac bug on trees of forest in India and Thailand. So they are given a choice whether it is an animal source or mineral source, marine source, vegetable source. So the answer is very clear, it's an animal source. So usually we should not do mistake in this shellac, remember. So the third question, carrageenan, how we selected carrageenan and the doubt in the citin, I have clearly explained. So the students cannot forget, this will come and ring in your mind, and you should select carrageenan is a marine product. Animal source is for shellac. Organized drug, also known as So in that case, you should remember what you studied in the organized, unorganized drug. Organized drugs will have cellular substances, cellular organs, and they are like leaf, root, stem, bark, flower. They are organized drug. Unorganized drugs are derived from the plant, or exudates which is produced from the plant, or extracts can also be told as unorganized drug. So organized drug, they are given a choice: cellular drugs, yes, cellular drugs, no, and unicellular drugs and multicellular drugs. There again they have given a check for you. Unicellular, multicellular. This comes in bacteria, which you might, a virus which you might have studied about the microorganisms, like unicellular, multicellular. But cellular drugs usually organized drug. As I told, organized drug means leaf, root, stem, bark, rhizome, the parts of the plants. Acellular drugs are also known as the question. Acellular. So acellular means it should be unorganized drug. They are given a choice: organized drug, unorganized drug, vegetable drugs, none of the above. So we should select unorganized drug. Everybody knows unorganized drug are derived from the plant source, are derived from the animal source, or it's a derived from a crude drug. A drug are the product of the plant, animals and mineral source. They are derived, or they are divided into dried latex, dried juice, dried extract, gums, resin, fixed oils, and fats, waxes, volatile oils, animal products, minerals like solid, liquid, semi-solids, etc. So that is, you should know that is acellular, unorganized, cellular, organized. So what is the reason behind a classification of crude drugs? Why you want to classify? You might have studied alphabetical classification, pharmacological classification, taxonomical classification, and the chemical classification, chemo-taxonomical classification. So why we want to group of them and to identify? So what is the main reason? Study of crude drugs becoming easy and convenient? Yes, it is true. For systemic and scientific study, that is also true. To understand relationship between different crude drugs, that is also true. So all of them are true, so we have to say all of the above. So which one of the following is not a part of the classification of crude drug? So when you have studied many classifications like pharmacological classification, taxonomical classification, chemo classification, and morphological classification, there are many classifications which you study. So alphabetical classification, it comes. Chemo-taxonomical classification also we studied, and pharmacological classification is also there. Geographical classification, geographically we cannot classify crude drugs. So drugs will be available geographically, even different continent, different country, different altitudes. So they will be having the different botanical names and different family, different species. But geographically we cannot classify crude drugs. But geographical source we can say. So that's why it was confusing for the student. But this is what not classified. The crude drugs not classified in the form of geographical. Which pharmacopoeia classifies crude drugs according to alphabetic classification? British Pharmacopoeia or British Herbal Pharmacopoeia, Indian Pharmacopoeia 1955, and United States Pharmacopoeia, and all of them are classified in alphabetical classification. So all the above. Which one of the following drug is not under the list of organized drugs? Organized drugs. Just now we have discussed about what is organized and unorganized. Tulsi, we know that is an organized drug. Tulsi is a plant, whole plant is used, and the Senna leaf, pods have been used in Senna. It's also organized drug. Aloe vera, we know that is an aloe vera, the leaf with a thick one. Then clove, we know it is, we are using the clove for our food and various purpose. But aloe vera, are you using the leaf? No, we are using the exudate or the jelly part which is taken out from the leaf of the aloe vera. So it is an unorganized drug. It is derived from the leaf of aloe vera. So the answer is aloe vera, which is not coming under organized drug. All the others of them are organized drug. Tulsi, the whole plant is used. Senna, leaf and spores, even flower also used individually. They are all organized drug. Clove, the bud, flower bud of the clove, Eugenia caryophyllus, the flower have been used for various purposes. So that is also an organized drug. Aloe vera, we are not using the leaf directly. We are the exudate which is taken from the leaf, or the jelly part which is taken from the leaf, that contains various aloin, various glycoside which is having hair growth, skin problems, sun burns, all can be treated with aloe vera. So this is what we want to say. So aloe vera is not organized drug in this question. The answer. Which of the following drug is not under the list of unorganized drug? Gums, we know it is an unorganized drug. Gums, acacia, tragacan. Dried latex, we know that it is obtained from the Papaver somniferum, the poppy fruit. We might have studied that latex which is taken, morphine, codeine which is present in it. So that is also unorganized drug. Rhizomes like ginger, rhubarb, they are rhizomes which is undergrown stems which are not, it's a part of the plant, so they are organized drug. Resins, they are exudates from the plants, so they are unorganized drug. So which one of the following is not a list in the unorganized drug? Rhizomes. Resins, the picture which I showed, it is also exudate which is obtained. Plant used as purgative. Senna is a purgative, laxative, which can evacuate the bowel. Senna leaves, pods, they can be used for the androgen glycoside. Opium is not used as a purgative. Digitalis is for cardiac glycoside, it is not a purgative. Vasaka, we know that it is for cough, we have used, it is not a purgative. So Senna, the androgen glycoside, Senna angustifolia, Leguminosae is used for purgative. Plant used as an anti-malarial drug is anti-malarial drug. We know that malaria is one of the threat in Second World War. So they were using anti-malarial drug also. We know that quinine, cinchona, everybody knows. But apart from that, we have another drug also which is mentioned here. Coriander, no, it is not an anti-malarial. We know that. Fennel, no, it is not anti-malarial. They are flavoring agents and they are carbonatives. Liquorized sweetening agent, Adimadiram, which is not used as an anti-malarial. Artemisia is the plant which is an alternative for cinchona bark. This is artemisinin is used as an anti-malarial drug. Digitalis, everybody knows it is a cardiac glycoside, cardiotonic. So they have given choice, cardiotonic drug, cardiac depressant, no. It doesn't depress cardiac muscle. It gives strength to the cardiac muscle. It is not an anti-malarial. It is not CNS stimulant. So Digitalis is a cardiac tonic drug. Classification of drug based on chemical similarity of taxon. Chemical similarity. How you will identify similarity in chemical? There are alkaloids and alkaloids nitrogen containing compounds. In that there are many specific divisions like tropane alkaloids, tropane alkaloids, pyridine alkaloids, pyrrolidine alkaloids, piperidine alkaloids, like that many alkaloids are the indole alkaloids. So how will you make their relationship? By means of chemical classification, we want to the similarity of their taxon, similarity of their taxonomical and chemo. So chemical and taxonomical. Chemical and the taxonomical. Solanaceae family, all of them are having tropane alkaloids like that. So when you want to taxonomy and chemo, together we want to classify the drugs, then we can find out the similarity of the drugs. So that one, the classification is called chemo-taxonomical classification. So taxonomical classification is separate. Serotaxonomy is different by means of serum taking and what is that antigen antibody reaction, finding out and classifying plant extracts. And plants can be streamlined by serotaxonomy. Chemical classification by means of the chemical constituents, whether alkaloids, what type of alkaloids, glycosides, what type of glycosides, like that we can streamline by chemical classification. Chemo-taxonomical classification, which can give chemical and the similarity of the taxonomy. So select the drug which is not belonging to glycoside classes. They are given. So we should know Digitalis, we know it is a cardiac glycoside. So it is coming under glycoside. Senna, it is an androgen glycoside, it is coming under glycoside. Vinca, it is not glycoside. Vinca rosaceae, it contains vincrustin, vinblastin. They are alkaloids, and which is catharine alkaloids, which is used for anti-cancer drug. Castor is an androgen glycoside bark, which is also. So this is Vinca flowers, Vinca plant, Catharandus roseus, Apocynaceae, which is also very much useful anti-cancer drug and an alkaloid. So Vinca is not an glycoside group. Select the drug which is not belonging to alkaloid class. Ashoka is not alkaloid. Ashoka is a glycoside, and not even glycoside, we can say glycoside also present, but it tannins, especially Ashoka, long plant, Ashoka plant, which contain Ashoka bark usually. Datura, we know that it is an alkaloid. Datura stromanium, which contain atropine, hyoscyamin. So Datura is an alkaloid. Vinca, just now we told it is an alkaloid. Vasaka, Vasacinone, Vasacin, they are also present in an alkaloid. So, which one is not alkaloid? Ashoka is not an alkaloid. Ashoka, it contains major component of Ashoka bark is tannins and other extract. Even it contains tannins, flavonoids, and some contains little glycosides also. But it is not an alkaloid containing drug. So select the drug which is not belonging to tannin classes. Now tannin we have seen. Which one is not belonging to tannin? Catechu, black catechu, pale catechu. We might have studied about the Gambier fluorescent test for identifying its presence of tannins, flavotannins. It's tannin drug. Myrobalan is also tannin. Clove is not a tannin, it is a volatile oil. Ashoka is a tannin drug. Clove is volatile oil which contain eugenol, antiseptic, and it is an carminative. It's a very interesting drug which is used for various ailments. So this is clove, we know that flower, and this is just myrobalan. Just a catechu everybody knows, Ashoka we have seen. So myrobalan, it is a Prunus ceracifera. Prunus ceracifera myrobalan. That is also tannin. So clove is not coming under tannin. It is volatile oil. So drug not belonging to volatile oil classes now. I told clove is volatile oil. See now, so clove is volatile oil. Eucalyptus, you know that eucalyptus is volatile oil. Cinnamon is also volatile oil. Patta, that means carafa. Cinnamon is volatile oil. So all of them are volatile oil. So none of them we cannot say it is belonging not volatile oil. All the three of them volatile oils. Classification or application, the application of serology is solving taxonomic problem is called, if suppose serological, serotaxonomy, chemo-taxonomy, we told how the taxon is relating to its chemistry. Serology is solving the problem is called serotaxonomical classification. The serum which is taken and reacting with antibodies find out, and that type of classification, serotaxonomical classification. Chemo is chemo with taxo and taxonomical pure classification. Swelling index is used to determine amount of the following determine amount of the following in the crude drug. What type of amount? Determine which amount? Moisture, the quantity of moisture? No. Quantity of volatile oil? No. Quantity of fiber, crude fiber? No. Mucilage, the swelling, how much the mucilage? That much it will swell. Like there are drugs which you are like Isabgol, linseed. They are famous for mucilage and which is used for purgative purpose and laxative purpose. Drug degradation by a substance resembling the genuine drug morphologically, organoleptically is termed. What is the question? Always you should read and understand the question. The drug degradation, something drug is degraded, spoiled by a substance resembling to the genuine drug morphologically, organoleptically is termed as. But morphology looks very nice, smell very nice, but it is spoiled but looks nice. What is the name of that? Whether it is substitution or spoilage, adulteration well. That is called adulteration well, deterioration. So you should know that substitution, substituting something. This is not substituting. This is adulteration, something which is already deterioration or degraded, which is having the morphology, made some color, adding some color and made it more glowable, and just you are selling it. Adulteration well, that is called. And then dash is an admixture or substitution of genuine drug with spurious, inferior, defective, useless or harmless substance. When you are adding, admixing, what is it? Adulteration. So you should know, if you are adding spurious, inferior drugs, unless harmless, so they will give choice of substitution. It is not called substitution, it is not called spoilage, it is not called admixture. If you are adding spurious, inferior, defective, useless, harmful, intentionally or non-intentionally, if it is there, then it is called adulteration. You can see adulterated turmeric itself which will float, which will not go down, and purity can be identified. Dash is the impairment in drug quality. Dash is impairment. What is the impairment of drug quality? It is inferiority, sophistication, admixture, deterioration. Deterioration means degradation of bioactive compounds by light, thermal effect, oxidation, hydrolysis, due to pH change or due to enzyme attack from the outside or bacteria. So they will call deterioration. Deterioration is impairment in drug quality. So that is very important issue. Storage of the drugs, very important. Dash is defined as intentional type of adulteration. Intentionally you are adding spoilage, admixture, sophistication. Sophistication is the word intentional adulteration. I want to make profit. I am just making it very glower, making it beautiful, making it same like original. So that is why it is called sophistication. Adding most of the time some powder which is similar to ginger powder. Coffee can be added with the skin of tamarind. So like that, many people, they used to use same color, same taste can also be added. So usually sophistication means, the word in English, we know it is an addition of an inferior spurious material to the drug with intention of defraud. When admixture is done intentionally to defraud, to make money, to fool or to cheat, then it is case of sophistication. It is also known as true. That is not true. We can say sometimes, we can say looks like is a glamorous sophistication. Dash is addition of any standard drug. Dash is addition of any standard drug. They are given choice: inferiority, admixture, spoilage, substitution. Addition of substandard. The word is not standard. I read the standard. Substandard drug. When you say any substandard drug, means substandard. The standard of the drug is not up to the mark. So substandard means it is not admixture, spoilage or substitution. We can say inferiority, inferior quality. So like when you are taking papaya seeds and adding with piper nigrum and the flowers, Catranthus tintorium can be given for Crocus sativum. So like that, for a substance which can be added inferior, that is. Dash is accidental addition of one object into another due to ignorance or careless. That means collection. Somebody who doesn't know, they may add without knowledge. That is dash accidental addition. Whether it is inferiority, substitution, spoilage, it is admixture. Because carelessness, ignorance, somebody doesn't know, they may add with stalk, with stem, with cloud, sometimes some other parts, not intentionally, while collecting it may be added. So that may be sometimes even debris, little sand or clay while you are collecting before removing properly. So processing defect, it is admixture. Like clove, mother clove can be added with the bud. Flower buds will have the volatile oil, but if it is once it is mother clove, then the volatile oil will become inferior. So that is called admixture. 28, the question, dash occurs as a result of microbial attack whether it is substitution, spoilage, inferiority, admixture. That is spoilage by microbial attack. Examples we can see in many places how the drugs have been attacked. 29 dash evaluation of a drug involves determination in color, odor, taste, size, shape, touch and texture. That is morphological and organoleptic characters. So you can say it is organoleptical character, not physical, organoleptic, chemical, biological. So we have to select organoleptic. It's having color, odor, taste, size, shape, touch and texture. So you see all the sensory organs. So dash is a quality evaluation type in which the morphological and sensory characters of drugs are studied. That means organoleptic very clearly. So organoleptic characters means color, taste, size, shape, all things together. Sensory characters. Biological or chemical, organoleptic or physical. Organoleptic is the answer. And 31 dash are the different forms and are used to plants for storing foods. Flowers, leaves, bark, underground structures. So this is talking about the plant. Plant, even this is a doubtful for the student. Plant can store starch. Plant can store starch in the seed. Plant can store starches in the wood, in the stem. Then why we want to say only underground structures? So in that form, flowers, leaf, barks they have given. They also will have starch grains, starch deposits. But in large quantities, underground structures like tobacco, ginger, rhubarb, all of them they are having lots of starch content, lots of the storage content of the food which is produced by the plant. So that's why storing food can be plants in different parts like flower, leaf, bark, stem, root. Underground they usually more storage are seen in the plant. Drugs contain volatile oil have a characteristic which will not be present if the drug loses their volatile oil. What if their volatile oil is not present? Whether texture will go, taste will go? No. The odor will go. The flavor will go. So odor is the answer. Fracture will not change. So odor will be loose if it is losing volatile oil or essential oil. A drug's dash depends on the nature of tissues and the method of drying is, if suppose a drug depends on the nature of the tissue and the method of drying, what it depends whether it is odor. No, I don't think it is. Odor will not have a much different. Fracture, brittleness, breaking. Fracture will change by means of your drying in the tissue structure. Texture, outer external structure may not change much by means of this tissue and the method of drying. Taste also, not much. There will be, but fracture, the brittleness, lightness, heaviness, breakingness, this will change. So we can select fracture. So we can see 34 is the average number of stomata present in per square millimeter of leaf epidermis. Average number of stomata present in per square millimeter. That is stomatal number. But they have given choice whether it is palisade ratio, is it stomatal number or stomatal index. Stomatal index means it is percentage. Stomatal index, or it is vein termination number or vein islet number or vein termination number. No, it is stomatal number. number of stomata present in a square millimeter of an epidermis cell, just a number. Dash is the percentage which the number of stomata forms in the total number of epidermis cells. Here you will have to count the epidermal cells also and count the stomata also, and the percentage have to be determined. So vein islet terminal number, no. Stomatal number, no. Palisade ratio, no. It is stomatal index. Stomatal index, you can see I is equal to S by ES. E plus S means I is stomatal index, S means stomatal number divided by number of epidermal cells plus stomatal number. So that gives you stomatal index. So dash compounds are heterocyclic nitrogenous. You know very well alkaloids should contain nitrogen in their ring usually. Sometimes some rare outside the ring, but usually they are inside the ring, one or more nitrogen. They are basic in nature. So alkaloids is the answer, but they are given choice. Terpenoids, no. Terpenoids, they are not having nitrogen compound. They are having terpenoids, double bond compounds, olefins. They will be having dimethyl allyl pyrophosphate, like isoprene units, which you might have studied about cholesterols, steroids, sterols. So they are not nitrogenous compound. Glycosides, they are also not nitrogenous heterocyclic compounds. Tannins, they are phenolic compounds, but we cannot say it is a nitrogenous compound. So alkaloids is heterocyclic nitrogenous compounds. So dash gives name alkaloid to the nitrogenous containing basic compound obtained from plant. This name is given by, is it by Galen? You know that is Galen is not, is a doctor, father of medicine. And W. Messiner is the person who gave the name of nitrogenous basic compound alkaloid, the name alkaloid to nitrogen containing compound, W. Messiner. Selder, no. Selder, he has identified many plants. Ladenburg, we have given Ladenburg is having some relation for alkaloids also. Dash stated alkaloids as a compound originated from plant with a basic nature having one or more nitrogen in the ring structure. This is given by Landberg. So he has told one or more. The previous one you should remember, W. Messeler given the number nitrogen containing, but Landberg he told one or more nitrogen. Galen no, Scherzer no, and W. Messinley he told only nitrogen containing. Here he told one or more. So these are some of the examples like morphine, quinine, ephedrine. See the nitrogen containing. There are two. Strychnine, there are two nitrogen. Nicotine, there are two nitrogen. Morphine, there is one nitrogen in the ring. And the quinine, there is two nitrogen. So you can see chemical test for flavonoids. Flavonoid glycoside is, they are given choice of fluorescent test. No, it is for tannin. And the Baljet test is for cardiac glycosides, not cardiac glycosides. Ammonia test is for flavonoid glycoside test. Legal test is for glycosides. But ammonia test you should remember, flavonoid glycoside, yellow color. Very simple test you can remember. Dilute ammonia, 5 ml was added to a portion of an aqueous filter of an extract. Concentrated sulfuric acid was added. A yellow coloration that disappears on standing indicates the presence of flavonoids. So you should remember flavonoid glycoside ammonia test. Stomata present in Senna or in which type. There are many types are there: anisotypic, anemotypic, cruciferous, parasitic. So anemocytic, no. Anisocytic, no. Parasitic. The cells will be parallel near to. Diacytic is also there. Diacytic, that is DIA, it should be discytic, they have written diacytic. So you can see that is anemocytic, anisocytic, diacytic, DA is missing in that choice. Parasitic, you can see parasitic, the picture, the stomata and the cells, epidermal cells will be parallel to the stomata. So there is parasite. This type of parasite is present in Senna. Dog Senna, we might have seen in the roads. The leaf will be round in shape, not sharp. Original Senna will be sharp. So what is the dog Senna? They have given Cassia angustifolia is original Senna. Cassia Senna is also not that dog Senna. Cassia obovata. Cassia obovata. So you may not expect it. Dog Senna, the name of dog Senna is Cassia obovata. Cassia accidental. These all are different species for Senna, but this is the dog Senna. A small secretory canal above vascular bundle is seen in the TS of what they have, secretory canal. Fennel, coriander, caraway. You might not have done this caraway, but fennel, you know, it is in fennel, terenjirangam, coriander malli, and caraway is jeera, and dill, which is sombo, that is also different, same variety of Umbelliferous family. The first one is caraway, the second one is, you can see this one is caraway, and this one is fennel, this one is coriander, and this one is dill. But the secretory canal can be seen in caraway, near vascular bundle, in the primary ridges. There are two vitae in each mericarp of, you might known about mericarp and cremocarp. Cremocarp means together, when it is made into two parts, you might have seen this fennel, coriander, even caraway, you can make it into two parts. Section also we can take TS. In that, you can see primary ridges, secondary ridges, vitae, oil cells will be there. Vitae are oil cells. So this is the anise, and this is the section of coriander, and you can see all of them, they will have not two vitae. In the mericarp they will be having many, actually they will be having minimum. In the one mericarp means commissural surface, that means dorsal surface and ventral surface, they used to say dorsal surface and commissural surface. Instead of ventral surface, they will say commissural surface, where the carbophore and two vitae are there. So usually they are saying mericarp. The question says mericarp containing two vitae. Caraway also having many vitae. See, dill also having many vitae, more than two. Anise also having more than two. So none of the above is the answer. So even caraway also having not more than 6 vitae in one mericarp. Aloe obtained from the dried juice of leaves of Aloe borbidens is the botanical source. Rheum palmatum is rhubarb. It is not the source. It is not the botanical source of aloe. Ricinus communis, everybody knows it is. The Ricinus communis means castor oil plant. None of the above. They have given the choice. But the answer is Aloe borbidensis for aloe. This is the Aloe borbidensis. This is the picture which is Rheum palmatum. The rhubarb, Ricinus communis, everybody knows, castor oil, almanac. So ashwagandha is a common name for Withenia somniferum. Which one? What is the source of ashwagandha? Withenia somniferum. Holarina antidescendrica is a kurchi bark. It is not ashwagandha. Bacopa Moneria is also not, Bacaponeria is not, it is also one terminalia variety. And Cinderella asiatica, we know that Cinderella asiatica is Brahmi. So this is Withinia somniferum, Ashwagandha. And this is what I told Bacopa monipa, that means for example Shellac. It can be leaves or sometimes they are using for various purpose. This is Brahmi, which is Cinderella asiatica for memory, and they used to use for various purposes in memory loss, and they are used for various treatments. Aloe belongs to the family of Polygonaceae, Liliaceae, Euphorbiaceae, none of the above. What is the family? Liliaceae is the family for aloes. So, rhubarb is obtained from rhizome of. So, rhubarb is a rhizome which we are using for crude drug, and they are asking for the source. Ricinus communis, everybody knows it is not for rhubarb, it is castor oil or castor plant. Aloe barbidans, that is also we know it is aloe. Rheum palmitum, just we have discussed. So students should remember this. Rheum palmitum is the rhubarb source. None of the above is, they are given a choice. So this is rhubarb, rhizome, the rhubarb plant. Rhubarb belongs to the family Polygonaceae, Liliaceae for aloes, Euphorbiaceae not for here, none of the above. Which part of the rhubarb is used? Leaf, bark, juice or rhizome? Student will write very clearly rhizome. Rhizome of the rhubarb is used, which is an androgen glycoside, laxative and many other skin purpose, many other cosmetic applications and internal applications, and tannins are also present in that. Rhubarb contains androgen derivatives, mucilage, barbaloin, none of the above. Barbaloin is present in aloe, but it is not present in this rhubarb. Mucilage is not there. Androgen derivatives. The main constituents of rhubarb include androgen glycosides, anthrones, stibulins, tannins and polysaccharides. Castor oil is obtained from the seeds of, you know very well, Plantago ovata, Forskel is not there, Ricinus communis, Rheum palmitum, none of the above. Ricinus communis, the source for castor plant. Everybody knows this plant. You might have seen castor seeds and castor oil. Castor oil belongs to the family of Polygonaceae, no. Liliaceae, no. Euphorbiaceae, Plantagenaceae, Euphorbiaceae family for castor plant. Ricinus communis. Castor oil contains resinolic acid, gallic acid, cinnamic acid, none of the above. Resinolic acid, fatty acid and a hydroxy acid, it is a major component of seed oil obtained from seeds of castor plant, Ricinus communis, family Euphorbiaceae. This is the structure of resinolic acid. Isabgol, very important drug for constipation. Isabgol obtained from a dried seeds of Plantago ovata, force. Plantago ovata, Ricinus communis, Rheum palmitum. Ricinus communis, you know, castor oil. Rheum palmitum is for rhubarb. So none of the above is also, these are all not answer. Plantago ovata is the answer. This is the Isabgol seed. Isabgol belongs to the family Scrophulariaceae, no, it is for Digitalis. Euphorbiaceae, no, it is for castor oil, castor plant. And Plantagenaceae is the family for Isabgol. Polygonaceae, no. Plantagenaceae is the family for Isabgol. What part of the Isabgol is used as a drug? Seed is the answer. Rhizome, they are given choice. Leaf and fruit. Seed, everybody knows. And Senna contains Sennoside A, Sennoside B, Sennoside C. All are present. All the above is present in the Senna. Androgen. Sennoside or Senna belongs to the family Leguminosaceae, not Euphorbiaceae, not Plantagenaceae, not Polygonaceae. Digitalis obtained from the dried leaf of Digitalis purpurea, we know that. Cassia angustifolia, no, it's for Senna. Digitalis purpurea. Terminalia Arjuna, no. And none of the above. This is for Digitalis. And you can see, among the following, which one of the following is used as a cardiac tonic? Arjuna, Senna, Rhubarb and cinnamon. So if they have written Digitalis, then we can select it. But Arjuna is also used as a cardiac tonic. Arjuna bark, Arjuna plant. And Arjuna belongs to the family Umbelliferaceae? No. That is, Umbelliferaceae means you should say about fennel, coriander, caraway, they all are Umbelliferaceae. Scrofularaceae? No, it is for Digitalis. Comfortaceae. Arjuna belongs to Comfortaceae. Laraceae? No. It is for Laraceae is for cinnamon. So you can see Comfortaceae is for Arjuna, belongs to Terminalia Arjuna, which is having cardiac tonic, it can be used. Which part of Arjuna is used as a cardiac tonic? Seed? No. It's bark. The picture which I have shown in the previous slide. Fruit, leaves. Bark is the answer which is used as a cardiac tonic. Arjuna contains tannins, triterpenoid saponins, arjunic acid, all of the above. So it contains all the above, tannins and triterpenoid saponins, arjunic acid. That means cardamom belongs to the family of Gingiberaceae. They have given choice of Umbelliferaceae, Comfortaceae and Piperaceae, but Gingiberaceae is the family for cardamom. Among the following, which one of the following is used as a laxative? Coriander? No, it's a flavoring agent. Carminative? Fennel? No. Digitalis cardiac glycoside. Isabgol is used as a laxative. Fennel obtained from the dried ripe fruit of the plant. Forniculum vulgare, we know that. This is for coriander, Coriandrum sativum. Forniculum vulgare. Terminalia Arjuna, no. And none of the above is the answer. Black pepper belongs to the family of Piperaceae. Black pepper belongs to the family Piperaceae. It's not from Umbelliferaceae. It is not from Comfortaceae. It is not from Scrofularaceae. So this makes you to understand some of the sources very clearly. Listen, it will be helpful for you. Among the following carminative, which one is not a carminative? Which one is not a carminative? Fennel is a carminative. Asafoetida, Kayam, is a carminative. Senna is not a carminative, it is a laxative. Cinnamon is a carminative. So Senna is not a carminative in the list. Tulsi obtained from the dried leaves of, what is the source of Ocimum sanctium? Ocimum sanctium. Adathoda Vasaga is not the Tulsi's botanical source. Catranthus roseus, you know very well it is for Vinca. None of the above. Ocimum sanctium is the source for Tulsi. Tulsi belongs to the family Acanthaceae? No. Labiatae? Apocynaceae? No. And Hypoceraceae? No. It is Labiatae, Tulsi. Among the following, which is used as an antitussive for throat, smoothness, cough? Vasaka, vasacinone, which is present in Vasaka, which has an antitussive effect and even expectorant effect also it has. Ergot? No. Cinnamon? No. Clove? No. It's volatile oil, cinnamon volatile. Ergot is different, abortifying agent. So, Vasaka is the answer for antitussive. Turmeric is used as antiseptic. Correct. Laxative? No. Carbonative? No. Antitussive? No. Antiseptic. Amla contains vitamin A? No. Vitamin C? Anybody will write very clearly. And with B? No. D? No. Sarpagandha is related to Sarpagandha. The roots looks like snake. Your teacher might have told. Ravalfia is the answer. Ravalfia serpentina. Arjuna, no. Naxomica, no. Physostigma, no. Ravalfia is the answer. Deadly nightshade plant is related to, you can see the picture, deadly nightshade plant. Which one? Belladonna. Hyoscyamus niger, no. Datura stramonium, no. Belladonna is called nightshade, deadly nightshade, the synonym for belladonna. And the choice is, even they are given none of the above, but belladonna is the answer. Naxomica belongs to the family. Naxomica is an important stimulant. Rubiaceae, no. Loganaceae. Remember, Naxomica belongs to Loganaceae. Papaveraceae, no, it's for opium. Apocynaceae, no, Vinca. Which one of these alkaloids is volatile in nature? Alkaloids volatile in nature, very rare. Narcotine, narcotine, no. Papaverine, no, they are present in opium. Nicotine is a volatile alkaloid. Thebaine, no. Because it contains oxygen-free alkaloids such as nicotine, there is no oxygen, or conane, are typical volatile, colorless oil liquid. And killer kilani test is specified for, everybody knows it's for Digitalis. But what for? A-glycan part of Digitalis glycosides? No. A-glycan part? No. It is for sugar part. Glycan part. Glycan part of Digitalis glycoside. Both glycan and A-glycan? No. It's only for glycan part. None of the above. The answer is killer kilani test is for only for the glycan part. How many types of Vedas are there? Vedas. Rig Veda, Ayurveda, Samaveda, Other Veda. So, 1, 2, 3 or 4. 4 is the answer. 4 Vedas are there. The first concept of Ayurveda is Charaka Samhita. Other Veda? No, the first concept is not Other Veda. Charaka Samhita is the first concept of Ayurveda. Sushruta Smhita is not there. All the above is not the answer. Ayurveda literature which aimed on surgeries, that is Sushruta Samhita. Adarvano Charaka Samhita is the concept. Sushruta Samhita is the surgery which is aimed for surgery in Ayurveda. What are the 6 stages? There is Agni relates to movement of the body, digestion and the metabolism. Actually, digestion and metabolism. In the picture I showed digestion, metabolism, Agni. in Ayurveda, Agni, digestion and metabolism. Space within the body, no. None of the above, no. So digestion and metabolism, Agni is related. According to Ayurveda, there are 6 stages of diseases. What are they? Samchaya, accumulated. Prakopa, aggravated. Prasara, disseminated. Sthana samsraya, localized. Vyakti, manifest. Bida, chronic. So this is the 6 stages of Ayurveda. 2, 4, they are given choice 5. We know it is 6 stages are there. Siddha. Siddha system of medicine is originated from Tamil culture. They are given choice of Bengal culture, Punjabi culture, Northeast culture. It is from Tamil culture. Kaya Kalpa or Kaya Karpam is also known as Kaya Kalpa, means a method of Siddhas in scientific approach which has been used in Journal, that is Kaya Kalpam, which is an aging older adults, and gerontology is involved in the longevity of the improvements, and neurology or microbiology or gerontology, and actually it is gerontology. Gerontology is the study of aging and the older adults. Problems can be solved. Kaya Karpam. Kaya Karpam is known as gerontology. And you can see Unani system was originated from, everybody thinks about Arab, actually Arab medicine which is followed, but it is originated from Greece. They are given choice Iran, China, India. No, it is from Greece. Homeopathy system of the medicine is based on the principle of law of similia. That you know, law of similia is applicable. Minimum dose, very small dose is applicable. Totality of the symptom they used to see. So all the above is the answer. Classical Ayurvedic formulation includes arc, basma, churna, all the above. Arc is there, basma is there, churna is there. Arc means usually it is of herbal distillate. Arc, basma everybody knows, calcium containing basma. Churna is powder and all the above. Pak, powder made by calcification is also known as churna. Basma it is. And the pak is also there. So we should know what is a pak. Pak is an Ayurvedic apodiotic. That means, for example, this is one type of advertisement they used to make. Human, whether it is male, they were having potential, that potentiality, that is, for example, impotency can be come across and they can be overcome. There is lot of false message also there, but still pak is an Ayurvedic apodiotic for men, and Supri Pak is one of the top Ayurvedic medicine for leucorium, which is it can improve the sperm count also, and using various medicinal treatment, variety of problems related to female reproductive system as recommended by Ayurveda. And Gutika is also a mediated, it is medicated. It is actually, it is ghee product, Gutika. So Basma is a calcification. The question is powder made up of calcification. What is the example? Basma. And herbal granules used in Ayurveda, Churana, Basma, Pak. So in Pak, the granules are used. So Pak, you can see granules. You may be knowing what is granules, not tablets. Before preparing tablets, we will make granules. Granules are in the Pak. Pak is aphrodisiac preparation, which is mostly used for men for various impotency and also human or women also for pregnancy and also other problems, hormonal problems can also be solved. What is another name for resins? No. Oils? No. Powders? No. Tablets can also be in the form, in the shape round, oval, can also be seen. Arista is a fermented decoction. You know Arista, Aswa, they are all fermented alcoholic preparation of Ayurveda. They are alcoholic medication prepared for allowing the herbal juice and their decoction of undergo fermentation with an addition of sugar, jaggery. Aristas are made up of decoction herbs boiling in water. Aswas are prepared directly using fresh herbal. That is the difference. Only the difference that is there. So we can say fermented infusion, fermented decoction is Arista. Fermented infusion, decoction, you can say Arista, herbal medicine, and you can say that is Arista is a fermented decoction. Standardization of ASVA includes the following parameters: organoleptic parameters, chemical parameters, physical parameters. All the above is needed for any standardization. Avalega or lega is a semi-solid preparation, legium, Ayurvedic pharmaceutical intended for internal use, and that one legium is also known as Arista, no, Avalega, it can be called as Avalega, Asva, and none of the above. Avalega, legia can be called as Avalega. Sodana is one of the name for purification. Sodana is an important technique which is used in Ayurveda for removing any type of their dosas, impurities can be removed by purifying. The picture shows that is how they are purified. Answer: distillation, maceration, filtration, purification. So, Sodana in Ayurveda it is called purification. Asva is, they are given Asva is fermented decoction or fermented infusion or both A and B or none of the above. So, Asva is fermented infusion, Arista is fermented decoction. Always you remember, Ashwa can be called as fermented infusion because fresh juice is used for alcoholic preparation fermentation, and dried powder or dried bark or dried root can be used for Arista. So it is called fermented decoction. So fermented decoction means Arista, fermented infusion means Aswa. Arc contain herbal juice, powder drug, medicated butter, and distillate of herbs. That we have told already. Arc means it is distillate herbs. So now, according to Unani system of medicine, human body is made up of how many elements? 4. Hot, wet, dry, cold. You can see blood, plum, black, blue, yellow, bile. So this is the elements. They have temperaments. The 4 simple individual entitled are earth, water, ma, nor fire, and air, not constitute the primary component of human body, makes the other, according to Unani system. So 4 is the answer, not 6, not 7, not 8. There are dash essential temperate. How many? 4 essential. There are also 4 essential temperaments. What are the temperaments? Hot, wet, dry, cold. They are the 4 humors temperament can be given. Which theory is followed in Siddha system of medicine? Tridosas, Panchamahabhuta, Triguna, Hippocratic theory. Triguna is the answer. So Trigunas, Sattva, Rajas, Tamas of Trigunas. The basic principle of Siddha system. It is based on 3 principles with Vada, Pitta, Kapha. Vada, Pitta, Kapha, which is known as Trigunas. So very clearly we should know about Tamas, Sattvas and Rajas, how it is related with Vada, Pitta, Kapha. And thank you very much for the students who have attended this 100 questions, only 100 questions. I was able to give you for pharmacognosy. Next class we will see pharmaceutics or biochemistry, any one subject for 100 questions I will come. Try to subscribe my channel so that you will get the class when I am adding. I may not add immediately. It takes time for me to prepare and to show some pictures, something to prepare so that the students can listen. At least listen. If not able to see the video, you can listen by means of earphone. So the answers will ring in your ear. So all over India, I hope all the diploma students for their exit exam start now itself to listen this type of videos, this type of which is service which I have done, which there are many like me, many people will start doing, utilize their classes. Thank you very much. Have a great day.